When Providence Healthcare started on our journey towards patient and family-centered care, we engaged with the Institute for Patient and Family-Centered Care. And one of their first recommendations to us was that we create a family presence policy that welcomes families at the choice of the patient to all of our sites. We define family as it is defined by the patient. So each patient has the opportunity to state who they feel is family to them.
I was fortunate where a friend looked after me the moment I got back to the room following the surgery. It was so amazingly wonderful that I can really appreciate that we have the 24/7 now. It's so important.
The visitation policy really has given us permission to be how we want to be with family members and made it an organizational direction that we can fully support. And we partner with families in terms of knowing when they're going to come to visit, what would make their visit best, and we let them know from a resident's viewpoint if there are certain times a day that works better for their loved one, and we try and make that visitation as helpful, beautiful, and soul-enriching as possible.
It's actually saying, come into our hospital, come in through those doors, come be with your family. We're a visitor in your life. Come forth with your family. So you're here, then we can address concerns that the family have and the patient has.
When I think about patient and family-centered care is that when we're talking to a patient, we also consider the input and the perspectives of the family members who are close to that person, of course with the patient's permission. Sometimes when a person is very sick, it's really hard to understand what's happening. And having a family member at the bedside helps to translate the information. They can ask clarifying questions. They can have a better understanding of what's going on for the patient. They can ask questions that maybe the patient has forgotten or issues that they may not bring up but are important that we may not appreciate. So just having another perspective really helps us better understand what the person is experiencing and what they need from us.
It helps with communication, it helps with transparency, it helps with the feeling vulnerable, it helps with anxiety and fear.
As the loved one is recuperating, the family members are not recuperating. The family members, their anxiety levels are increased. Everything's increased at that point. They're totally heightened in regards to stress. So anything that the hospital can do and nurses can do and doctors can do to alleviate that, the better.
We actually changed the way we did rounds on patients. We had frail, elderly people, many who didn't speak English. There wasn't always a translator available. So we invited families to attend our rounds. So we would bring the whole team around. The family would be there, the patient would be there. We would discuss the course, the plans, the goals. We would check out with the family, if they had any questions. It completely changes the dynamic. It provided so much comfort and confidence to the patient and the family. It brought the team together in a way that simply didn't happen. When we weren't doing those things, we were sitting in a staff room in the back and going through charts as a team.
They've done an exceptional job. The doctors, the nurses, everyone has been exceptional. But even being exceptional, there's still a large gap where improvement can take place.
And from the Open Visitation Committee came this idea for a charter, where the nurses would outline what we're committed to with open visitation, bringing them in earlier after their loved one came out of surgery, allowing them to stay longer if they wanted, allowing them to stay overnight if they chose to, and just being more available to answer questions and more engaged sometimes. We have to always be thinking about the patients and families and how they want to be treated.
If I was this family member, I would really want to see my loved one right now, right when they get out of surgery, and I can take 1 minute and just let them know that, okay, you can come in, your family member's doing well, and just let them see what's going on and that their family's okay, out of surgery and recovering.
I think it's a wonderful thing to include families as part of the therapeutic relationship when possible. It fits with the mission of the hospital, which is one around compassionate care and social justice. I think that's aligned in treating people with dignity and respect.
There is a connection that we all feel that we need to be connected to something greater than ourselves, and being able to support family members to come whenever they can is really enhancing that connection, supporting that connection.